Bismillahirrahmanirrahim. My name is Zahid Ali, roll number 1550213. Today I present my topic which is postpartum hemorrhage. In postpartum hemorrhage is more bleeding than normal after the birth of baby. The ratio of postpartum hemorrhage is about 1 in 100 to 5 in 100 women have postpartum hemorrhage. It is more likely with a cesarean birth means C-section. It most often happens after the placenta is delivered, but it can also happen later. Symptoms: uncontrolled bleeding, like more bleeding, decrease blood pressure, increase heart rate, decrease in RBC, swelling and pain in vagina. Causes: the causes of postpartum hemorrhage is four T's can be used to identify and address the four most common cause of the postpartum hemorrhage, like tune, trauma, tissue, thrombin. Number first is uterine atony, tone, laceration, hematoma, inversion, rupture, trauma. Laser means cut in the flesh. Hematoma means blood in urine. Retained tissue or invasion tissue, and thrombin. Risk factor for postpartum hemorrhage: some women are at great risk of postpartum hemorrhage than others. Condition that may increase the risk: placenta abruption, means placenta separate at early stage. Second is placenta previa, our distance uterus, means the baby placenta cover the cervix of the mother. Number 3 is multiple baby pregnancy. Number 4 is high BP disorders of pregnancy. And next is prolonged labor. And last one is infection. Now we have case study of postpartum hemorrhage. Subject: a 33-year-old female delivered a baby boy following Syrian section. This was her third baby and she had got two female children through the previous C-section. During her antenatal checkup, she was diagnosed have the placenta previa. Patient started having excessive blood during C-section. Placenta previa means baby placenta cover the mother cervix. Object: she was transfused 9 units of whole blood outside hospital and shifted to hospital on the same day. On arrival, she was conscious but irritable. Pulse rate was 150 per minute, respiratory rate 50 per minute, and gasping, so the patient was immediately intubated in emergency room. Hemoglobin was 80 gm percent, platelets count is 60,000 and NIR 2.15. So patient was shifted to OT and hysterectomy was done. Assessment: hematological report of patient during hospital stage. Number 1, hemoglobin. If we see the chart of hemoglobin from day 1 to day 7, the hemoglobin increased day by day. And second is TLC also increasing. If we see the chart of platelets also we have in better condition. HTC also increasing, INR also at good condition. Plan: patient was transfused 5 BTS, 4 pooled plasma and 4 platelets product in OT. On first day, patient was having bleeding per vagina, hematuria means blood in urine, through urine, and light tube bleeding for sutural lines for nostrils. Patient was diagnosed to be in is immediate intravascular coagulation and 2 FFC. So one single donor platelets and one whole body transfuse was given. Blood pressure was still dropped, so patient was taken inotropin support of dopamine and norepinephrine. After this, the patient BP was improved to 124 to 60. Pulse rate was 130 minute. Central venous pressure is 10 cm of normal saline and urine output was adequate. For next 4 days, patient was kept on the completely ventilator support after adequate sedation. Thank you.